All right, welcome back in Live Now. I'm Austin Westfall. Utah has become the first state to ban fluoride in public drinking water. It's pushing past opposition from some dentists and health organizations who warn that the move could lead to medical problems for some people. Republican Governor Spencer Cox signed the legislation on Thursday, barring cities and communities from deciding whether to add the mineral to their water systems. The Associated Press says that Florida, Ohio, and South Carolina are considering similar measures as well. Dr. Peter Chin-Hong is here to talk about it. So, Doctor, what does the science say about fluoride in water?
So the science says three things. First of all, fluoride replaces the loss of natural minerals that are responsible for giving us this barrier to protect us against caries. The second thing is that it reduces the proportion of bacteria that make acid to sort of erode our teeth. And the third is that it itself forms a shield to kind of protect us from, erosion of teeth to caries. So many reasons to keep fluoride water at the right dose.
So, why has this become a conversation? We've been watching as the months have progressed, and we've seen one administration go out and a new administration come in. Why is this a topic of discussion?
It's a topic. It's a topic of discussion because overall people are worried about the influence of public health on overall protection of the community. But I think it's really foolhardy to think about fluoride in the same way because you can't make a personal decision and fluoridate your home supply of water. It has to be for public benefit. So I think that's part of it, having individual choice versus choice on a population. But do realize that just because you don't see something doesn't mean it's not working. In fact, the reason why we have, as good dental care in some communities as before is because of things like fluoride.
So, the American Dental Association says that cavities are the most common chronic childhood disease. They say fluoride strengthens teeth and reduces cavities by replacing minerals lost during normal wear and tear. That's according to the CDC. I guess my question for you about this is, with more states considering making this move, Doctor, are there more discussions to be had? And I guess one question that I would have for somebody like you is, when there are medical professionals who are on one side of this or the other side of this, how does that happen? How can doctors with medical degrees fall so far apart from each other on discussions like this? There's doctors on one far end of the spectrum and doctors on another far end of the spectrum. How does that happen?
Well, I think part of it is that people don't know, they take it for granted. Part of it is that the truth lies in between. Sure, there are studies showing that fluoride could reduce IQ in children, but that's with a really, really high dose. You can get fluoride at a low dose in the water supply, or you can get exposed to it unnaturally high from minerals and rocks because you live in that area. So it's like saying, let's have a really high dose of antibiotics and I'm going to get toxic, but the right dose is really important. So that's one thing. In terms of, other clinicians who may, choose one choice over the other, I really think it's just not necessarily knowing. And it's like one of these things where you don't need fluoride, but if you have access to health dental care, you can have somebody check your teeth all the time, give you fillings. But if you don't have access to health care or dental care, that's really where the trouble starts.
All right, Peter, as always, good talking to you. We'll see you soon. Have a good rest of your weekend.
Thanks a lot, Austin.